Hi guys, it's me, Darlene, and today we're going to be speaking about sexual health in older adults. And the reason why I picked this topic specifically is because this week, starting today, is the beginning of Sexual Health Awareness. What is sexual health? The World Health Organization, known as the WHO, defines sexual health as a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. Normalizing talk about sexual health. Many people want and need to be close to others as they grow older. For some, this includes a desire to continue an active, satisfying sexual life. With aging, that may mean adapting sexual activities to accommodate physical, health, and other changes. There are many different ways to have sex and be intimate, alone or with a partner. The expression of your sexuality could include many types of touch or stimulation. Some adults may choose not to engage in sexual activity, and that's also normal. Here, we explore some of the common problems older adults may face with sex, in which I'm going to be speaking about as we proceed with this topic. Normal changes. Normal aging brings physical changes in both men and women. These changes sometimes affect the ability to have and enjoy sex. A woman may notice changes in her vagina. As a woman ages, her vagina can shorten and narrow. Her vaginal walls can become thinner and a little stiffer. Most women will have less vaginal lubrication, and it may take more time for the vagina to naturally lubricate itself. These changes could make certain types of sexual activities, such as vaginal penetration, painful or less desirable. If vaginal dryness is an issue, using water-based lubrication, jelly, or lubricated condoms may be more comfortable. If a woman is using hormone therapy to treat hot flashes or other menopausal symptoms, she may want to have sex more often than she did before hormone therapy. This is a continuation of normal changes. As men get older, impotence, also called erectile dysfunction or ED, become more common. ED is the loss of ability to have an erection and keep an erection. ED may cause a man to take longer to have an erection. What causes sexual health problems? I'm going to be speaking about some causes of problems that affect sexual health and methods that you can take in order to alleviate these symptoms and enjoy sexuality. So, arthritis. Arthritis is a joint pain that can cause sexual contact to be uncomfortable. Exercise, drugs, and possible joint replacement surgery may help relieve this pain. Rest, warm baths, and changing the position of timing of sexual activity can be helpful. Chronic pain. Pain can interfere with intimacy between older people. Chronic pain does not have to be part of growing older and can often be treated, but some pain medicines can interfere with sexual function, so it is important to consult with your doctor or healthcare provider. Dementia. Some people with dementia show increased sexual desires or physical closenesses, but they may not be able to judge what is appropriate sexual behavior. Those with severe dementia may not recognize their spouse or partner, but they still desire sexual contact and may seek it with someone else. It can be confusing and difficult to know how to handle this situation. Here, too, talking with a doctor, nurse, and/or social worker with training in dementia can also be helpful. Diabetes. This is one of the illnesses that can cause ED, which is, as we discussed previously, erectile dysfunction in some men. In most cases, Medical treatment can help. Less is known about how diabetes affects sexuality in older women. Women with diabetes are more likely to have vaginal yeast infection, which can cause itching or irritation and make sex uncomfortable or undesirable. Yeast infections can be treated with medication, so also please talk to your healthcare provider. Heart disease is also a condition that can affect sexuality or sexual intimacy. Narrowing and hardening of the arteries can change blood vessels so that the blood does not flow freely. As a result, men and women may have problems with orgasm. For both men and women, it may take longer to become aroused, and for some men, it may be difficult to have or maintain an erection. People who have had a heart attack or even their partners may be afraid that having sex will cause another attack. Even though sexual activity is generally safe, always follow your doctor's advice. If your heart problems get worse and you may have chest pain or shortness of breath, even while resting, your doctor may want to change your treatment plan. Here are some more causes of sexual health problems. Incontinence. Loss of bladder control or leaking of urine is more common as people get older, especially women. Extra pressure on the belly during sex can cause loss of urine. This can be helped by changing positions or by emptying the bladder before and after sex. The good news is that incontinence can usually be treated. Stroke. The ability to have sex is sometimes affected by a stroke. A change in positions or medical devices may help people with ongoing weakness or paralysis to have sex. Some people with paralysis from the waist down are still able to experience orgasm and pleasure. Now, here's depression. Lack of interest in activity you used to enjoy, such as intimacy and sexual activity, can be a symptom of depression. It is sometimes hard to know if you're depressed, so it's good to speak to a social worker trained in depression or a psychologist, psychiatrist, or maybe your healthcare provider can refer you to some of these professionals. Surgery. Many of us worry about having any kind of surgery. It may be even more troubling when the breast or genital areas are involved. Most people do return to the kinds of sex life they enjoyed before surgery, and some of them do not. For example, hysterectomy is a surgery to remove a woman's uterus because of pain, bleeding, fibroids, and other reasons. Often, when an older woman has a hysterectomy, the ovaries are also removed. Deciding whether to have this surgery can leave both women and their partners worried about their future sex life. If you're concerned about any changes you might experience with a hysterectomy, also it is important to talk to your gynecologist or surgeon before having this procedure done. A mastectomy. A mastectomy is a surgery to remove all parts of a woman's breast because of breast cancer. This surgery may cause some women to lose their sexual interest or may leave them feeling less desirable or attractive to their partners. In addition to talking with your doctor, sometimes it is useful to talk with other women who have had this surgery. Now there's prostatectomy. And it is a surgery that removes all parts of a man's prostate because of cancer or an enlarged prostate. It may cause urinary incontinence or erectile dysfunction, but this is also treatable. Here are some more things that can affect sexual health. So the biggie is medications. Some drugs can cause sexual problems. These include some blood pressure medications, antihistamines, antidepressants, tranquilizers, Parkinson's disease or cancer medications, appetite suppressants, drugs for mental health problems, and ulcer drugs. Some can lead to ED, which is, again, erectile dysfunction, or make it hard for men to ejaculate. Some drugs can reduce a woman's sexual desire or cause vaginal dryness or difficult with arousal and orgasm. Check again with your doctor or healthcare provider to see if there is a different drug without these side effects. Now there's also alcohol. Too much alcohol can cause erectile problems in men and delay orgasm in women. So reducing the amount of alcohol you use as intake should help solve this problem. So here is $1 million question. Am I too old to worry about sexual diseases? So, age does not protect you from sexually transmitted diseases. Older adults who are sexually active may be at risk for diseases such as syphilis, gonorrhea, chlamydia, and genital herpes, hepatitis B, genital warts, and trichomosis. Almost anyone who is sexually active is also at risk of being infected with HIV, no matter the age. The virus that causes AIDS. The number of older adults with HIV and AIDS is growing. You are at risk of HIV or AIDS if you or your partner has more than one sexual partner, if you are having unprotected sex, or if either you or your partner is sharing needles. To protect yourself, always use a condom during sex that involves vaginal or anal penetration. A man needs to have a full erection before putting on a condom. So this is a teaching. Talk with your doctor or healthcare provider about ways to protect yourself from sexually transmitted diseases and infection, and go for regular checkups and testing. Also, it is important to talk with your partner, and it is also important to remember that you are never too old to be at risk. Now, sexual health and sexuality is a very sensitive topic to most, and many are afraid to speak up. However, do not be afraid to speak to your doctor or healthcare provider or partners about sexual difficulties that you may be experiencing. There are medications and alternative medicine treatment in the market that can help you live a healthy sexual life. As always, thank you for listening to my segments, especially this week's segments on mental health and sexual awareness on Sexual Awareness Week. Thank you.